In our first story, the National Peace Council is lamenting it is not getting the desired cooperation from the political parties in the attainment of electoral peace. Now, speaking to JoyNews, the Bono Regional Executive Secretary of the National Peace Council, Swala Abdallah Kwanda, says as a non-prosecutorial body, it could only continue its engagement with parties and other stakeholders in the drive to hold on to the peace the country is enjoying.
Peace building or peace work is a collective responsibility. You cannot force peace on people. So if people decide not to cooperate with you, it is very difficult for you to be able to facilitate the peace that you do. If you look at the underlying factors of all this violence in this election registration period, people busing people from different constituency to a constituency that they do not belong to. And they know it's against the law. But which people are doing it? It's the political parties. They are behind it. So are they cooperating? There is an arrangement or mechanism that if somebody is going to register and you do not agree, you suspect the person is not qualified to register, there is a process that you go through. You don't force the person out of the queue. The political parties have decided to disregard this mechanism. These are all things that we expect the political parties to know and adhere to. So if they don't do that, the best we can do is to continue talking, continue discussing with them, continue appealing to their conscience, continue appealing to their emotions, for them to appreciate the fact that what they are doing is not in the interest of peace. The political parties, yes, we are not saying that they are giving us problems, but they are not cooperating as we want them to cooperate.
Away from this, no, she was one of the frontline workers who dealt with Ghana's initial cases of Covid-19. But the numbers since have increased and now require more than what any health worker was prepared to give at the time. Evelyn Naki Dowona soon left her home to take up residence at the Ga East Municipal Hospital. This meant leaving behind her own mom and her 9-year-old son. Now here's a story about a mother and a health worker on the front line.
Hello. Yes, how are you?
I'm fine, ma.
A tired mother looks straight at the electronic device before her. She laughs. The tablet is the safest way to touch base with family, but keep her distance as she works to save lives. Evelyn Naki Dowona is Quality and Safety Manager, Infection, Prevention and Control at the Ga East Municipal Hospital. Her job involves ensuring that the facility meets world standards in treating COVID-19 patients. Over 400 patients have been here in the past 5 months with an encouraging rate of recovery. Evelyn is a mother of a 9-year-old who has always been close to his mother.
I've missed you.
Yes, I miss you too.
Evelyn has been living in a facility provided by the hospital for the past 5 months, sacrificing family time on her patients.
I moved in for the ending of beginning of March, and so I have to put in a whole lot. I haven't been able to go. I was able to go home once. We do a lot of WhatsApp call, video call to see them and talk. But if I had to go do something, my mom wants to see me. So he has a way of saying it. I bought something for you because you're not able to go to the market. Come for this nice dress, come for this shoe. Just ask permission and go and see them. They was like, oh, won't you sleep for today? No, my job doesn't mean I should sleep.
And with rising cases of coronavirus, she barely has time for anything else.
At times I even forget to eat. So one of them who has taken the responsibility, madam, you haven't eaten. Then just give me a reminder.
She thanks God for the staff of the Ga East Hospital who look out for each other within the period.
They are my deputies, I will say that. And so they've actually been able to man the front. And so I just get, instead of reporting at 6 a.m., I now come at 8:30. They've really helped me a lot, and I cannot do without them. And I say big thank you to them.
But her biggest motivation is little Emmanuel Anan, her son, living with her own mother, whom she checks up on from time to time. The love keeps her strong. The little boy's understanding of his mother's duties keeps her sane at such a period when she sacrifices to aid Ghana combat COVID-19.
I hope the president will want whatever you are doing and appreciate you.
Oh, okay. They were here, okay? But you have to stay safe for me, okay? And put on, well, use your sanitizer often, okay? I will stay safe. You to stay safe, okay?
PSC Nanaya Osafo, Joy News.
Bye.
And also related to this, but this is our last story. Kumasi-based educationist Theodosia Jackson now is drawing attention to what she observes is relaxation of measures to contain the spread of COVID-19. She's also worried people continue to flout the protocols with so much impunity despite increasing confirmed cases. Mrs. Jackson, who is principal of Jackson College of Education, now wants stringent measures introduced during a partial lockdown revisited. Mohammed Nuruddin now brings us the story.
The college is on a nationwide campaign to combat the COVID-19 pandemic in Ghana as a social responsibility initiative.
COVID, go away! COVID, go away! COVID, go away!
It is collaborating with Sinapi Aba Savings and Loans on the project launch in Kumasi with a call on government to intensify efforts to contain the virus.
This COVID spread is attitudinal, character, behavior, the way and manner we behave. It bothers me so much when I hear in my ears that COVID has come to stay. So I keep on asking myself, am I going to wear this mask for how long? Over 70 years. And if Almighty will add 30 to the 70, am I supposed to wear this anywhere I go?
She says it is unfair for section of the population to disregard the protocols and endanger the lives of law-abiding citizens.
I just want to draw the government's attention this morning. We are very serious here. When you even go to church, they take your temperature. They give you forms to fill to indicate where you will sit. You wash your hands, go through all the protocols before you enter. The people who go through all these protocols, where have they come from? They are the very people at the market. COVID had made some people gain in their businesses. And as I stand here on behalf of all private schools, we have lost so much. We can't even pay our workers. Children are at home. Shall we misbehave and look on for children to remain at home? In future, where will be our doctors, our nurses, and even the president? COVID, go away. Attitudinal behavior, character. Some people, it baffles me when they say that we should bring those who have died on TV before they believe. Do we bring those who have died because of malaria fever? Do we showcase those who have died because of cancer? Do we showcase those who have died because of AIDS? Why do you do things this way?
Well, insightful education right there. But that's it. The latest news updates we do have. But I have to say a very good morning to Nanaya Jemfikese. You're the Acting General Manager for Road Safety Management Services Limited. And I wish you all the best for the day. But we're taking a break. When we come back, we'll do a review of the newspapers. Do stay with us.